The intention of this standard is to reduce the risk of consumers acquiring preventable health care-associated infections, and to manage infections if they occur. It also aims to limit the development of antimicrobial resistance through the prudent use of antimicrobials. This standard has 4 underpinning criteria: clinical governance and quality improvement to prevent and control healthcare-associated infections, and support antimicrobial stewardship, infection prevention and control systems, reprocessing of reusable medical devices, and antimicrobial stewardship. There are 16 actions or activities that our service must have in place to meet this standard. Let's look at some questions that the assessors may ask to determine if we are meeting this standard.
Can you tell me how your service implements policies and procedures to minimize healthcare-associated infection?
We have a number of policies on infection prevention and control, and these include a hand hygiene policy. We undertake regular hand hygiene audits, and the results are reported at our clinical governance and team meetings.
Our infection prevention and control policies have been developed with consumer and carer input. We also have specific signage to encourage good hand hygiene practice by consumers and their visitors.
We have a system in place to ensure that all staff are made aware of changes in policy related to infection control. All staff sign to indicate that they have read and understand any policy change.
What surveillance data on healthcare-associated infections is collected? And how is data reported?
In mental health, we have relatively few healthcare-associated infections. However, if there is an infection, this is reported to the District Infection Control Committee, and I can show you minutes of this committee meeting.
How does your service ensure that its standard and transmission-based precautions are consistent with the Australian guidelines for the prevention and control of infections in healthcare?
On admission, our assessment includes the risk of infection. We have documented procedures for the management of infections including influenza. We have done extensive work in precautions against COVID-19, including the use of personal protective equipment. We have single rooms to support isolation if necessary.
We have all had training in the use of personal protective equipment, and there are records of this training. The rate of completion of this training is reported at our clinical governance meeting and at team meetings.
If a consumer has an infection that requires more sophisticated care, then that consumer is transferred from our service. Information on infection status is part of the electronic medical record.
We have cleaning schedules for all consumer areas, and audits of these cleaning schedules are undertaken. The results are reported at our clinical governance and team meetings.
We have regular audits of our medication refrigerators and audits of refrigerators that have consumer foods. We also audit staff refrigerators.
How does your service manage hand hygiene?
We ensure that all staff have had training in the 5 moments of hand hygiene. And we have training records that are reported at our clinical governance and team meetings. We also ensure that staff have had training in aseptic technique.
What systems are in place to ensure that your immunization program is consistent with national and state requirements?
It is a requirement of employment that staff have received all required vaccinations. The district maintains vaccination records, and these are reported at our clinical governance meeting. Recently we have done a lot of work to improve the rate of staff immunization.
How does your service manage reusable medical devices?
Our service does not use reusable medical devices. We only have single-use devices, and stock is monitored to ensure that it is within expiry dates.
What systems are in place to ensure the appropriate prescribing and use of antimicrobials in your service?
We have a policy on antimicrobial stewardship, and I can show you our antimicrobial formulary that includes restriction and approval procedures for alternative antimicrobial use. The district provides antimicrobial stewardship training, and I can show you records of attendance.
What processes are in place to evaluate antimicrobial use?
Our service has a medication committee, and I can show you minutes where antimicrobial prescribing and use were discussed. This committee links to the district committee to ensure organization-wide surveillance of antimicrobial stewardship.
The assessors will ask you questions about preventing and controlling healthcare-associated infections, how you gain access to the policies and procedures that guide your practice, the training you have received on preventing and controlling healthcare-associated infections, and they will also ask how we work to improve our systems for preventing and controlling healthcare-associated infections. What other evidence could your service provide to meet this standard?